So hello, everyone. My name is Melissa Brennan, and I want to welcome you today. I'd like to thank you for joining us. I work in the Institutional Advancement and Alumni Relations Office at Brandeis University, and we're very excited to have with us as a guest speaker today, Dr. Cheryl Pegus, class of '84. She'll be speaking with us today on several topics: how new medical technology and treatments are improving health outcomes for patients, the state of healthcare workforce and how to empower clinicians within their communities, and finally, our progress in advancing health equity and access to quality care. I think we're all going to learn and benefit from what she has to share with us, and she is not only an incredibly accomplished leader in her field, but is also a very inspiring, positive person. But before we begin, I'd like to introduce Kate Stutz, who will moderate our talk today. She is the Director of Pre-Health Advising and has been at Brandeis since 2016. Previously, she advised pre-health students at the University of Wisconsin while earning her master's degree in African American Studies and her PhD in Literary Studies. So without further ado, I'm going to turn it over to Kate. Thank you.
Hi, everyone. Good evening. Thanks for joining us. So I have the great pleasure of introducing Dr. Pegus. She is currently the managing director supporting the Morgan Health Ventures team. And previously, she was the executive vice president of health and wellness at Walmart, leading the company's healthcare vision and consumer-facing programs designed to raise the standard of care for millions of Americans. She's been consistently recognized as one of the country's most influential healthcare leaders and clinical executives. So we're so happy to have her here with us today. So I will start by asking some questions, and if you all have questions, you're welcome to use the Q&A feature, and I can sort of pose those for the conversation. But I think Dr. Pegus is going to start by saying a few words.
Thank you very much for having me. Hello, everyone. Great to hear how many people are interested in healthcare overall as a profession, but I'm sure just for our everyday lives. As you heard, I left Brandeis in 1984 after going pre-med, but also majoring in Afro and Afro-American studies, and really enjoyed my time. I think the things I took from me were that lots of my classmates were also pre-med, and that the work that we were going to do going forward was really grounded in, for many of you, I'm sure, those late night conversations or time spent on the weekend thinking about how do we contribute to making things better. For me, that was going to be in healthcare. And so thrilled to be invited back. I've met Melissa before and Kate, and looking forward to chatting with you today and hopefully answering questions that you may have.
Great. So to get us started, I was hoping that you could tell us a little bit about your experience at Brandeis and in what ways you feel like Brandeis prepared you for a career in medicine.
Yeah, so the first thing I would say, Brandeis's academic rigor made medical school seem doable, and in some classes even easy. So I will tell everyone there, as you're thinking about medical school, you're being really well prepared for that. I think the second is I had a lot of support at Brandeis in pursuing a career in medicine. And some of that was just acknowledging the work and how to manage my time and studying. So Gertzensang was the science library, and I could be there until 10 o'clock at night sometimes just getting my work done. But it really enabled me to learn how to do a lot of project management, time management, and still have fun, which I thought was really great for the way classes were organized. I would also say that Brandeis really also provided support in allowing us to learn what a profession in medicine really looked like. After my junior year in college, I did a summer program at Cornell, which is where I ended up going to medical school, and just knowing that those are the steps that you should take to, one, determine if this is the right profession for you, and two, beginning to understand the things that may be needed in medical school, because I got to spend a summer with medical students, was just really inspiring. And so I think academically prepared, early entry into what medicine could allow. And then thirdly, I think really figuring out that anything that you could contribute, I double majored in Afro-American studies, as I mentioned, of combining your own personal life story into what you were going to do as a career was something that was also really encouraged.
Great. And kind of building off of that, so you mentioned your double major in biology and African American studies. How do you see these two fields connecting in medicine and informing, your professional experience?
So when I got to Brandeis, I mean, I will tell you, my deep knowledge of Afro and Afro-American studies was not there. So there was a lot of great learning, and learning not just about older treatments in medicine, but learning across the discipline of Afro and Afro-American studies. And what I will say is, what it allowed me to do is recognize that when you don't know enough about something, you may repeat things that have already been tried, or you may not be thinking broadly enough. I think many of you have probably heard the term health disparities, health equity. I think we all think about how do different communities experience just life overall in general. For me, I look at it through a very specific healthcare lens. My double major allowed me to look back at how people are integrated into receiving healthcare, what their access looks like, what their needs look like, and on my end, what's the right training to be able to provide that. So I think it gives you a humbling aspect of, you may not know all the answers, even if you're well trained in science, but you also have to understand how people seek care. What's the trust related to that? What occurs? I spent a lot of time with Dr. Pouncey, who isn't there anymore, and he knew I was going pre-med, and he would say to me, so today in this class on sociology, what will you learn that will make you a better doctor? And it was just a great way to have someone say, don't just learn the knowledge, how will you apply it going forward? And that thoughtfulness, I think hopefully I've continued to use in the way I'm combining both of those. A lot of my work has been on health equity, and health equity is simply about access to healthcare, not across just race, ethnic groups, gender. It's simply good access to healthcare. And I think I started a lot of that by at least understanding historical, and then reading and continuing to learn today of how you combine these fields.
Okay, great. How did you develop your role and career as a health executive? Like, when did you decide to move, more out of the, clinical care realm and into this health executive role?
So as a physician today, I think many of us see one patient and we take care of them and we provide the best care that we can. And then we'll see another patient. And on average, we see that you can probably provide care for what we call a panel of patients, maybe 300 people in a year, maybe a little bit more. What you see in healthcare is that it's a systematic change that's needed. And to do that, you've got to start thinking of what are the systems of change. So the example that I would give is that in healthcare, we know cardiovascular disease is the #1 cause of death. It's the #1 cause of death for women, and for a long time underappreciated, and then for underserved minorities as well. Well, you could see one patient at a time and attempt to impact that, or you could try to influence, do all clinical studies that we do, what we call research trials, do they include enough women enough people of different races and ethnicities, so we understand how treatments impact them. To do that, you've got to understand how to conduct clinical trials overall in the US. That's actually my first entry into trying to broaden my own sphere of understanding that if the treatments have not included everyone, we see different results. By the way, for a long time, lots of studies in cardiovascular disease did not include women. And so devices that were designed for men who were larger were too large to be used in women. And that's because they weren't included in the clinical studies. And so first I started with clinical studies. And then after you learn that, you realize it doesn't matter how good the science is if physicians don't understand how people pay for healthcare or how people get insurance and how they utilize it. So I went on to learn about health insurance, and really, I think a really key component for us is understanding that how healthcare is financed in the US determines a lot of the outcomes that we see. And so it's really moving from an individual to a scaled national approach of how do we change our healthcare systems. I went back to school after medical school and got a master's in public health. And the combination of those have really helped me look at this holistically, nationally, and globally.
Great. So if you sort of talked about the need to take a systematic approach to really influence the system and provide better care. So how do you think healthcare is going to be changing, over the next 10 years? So for students that are in undergrad now and maybe hitting the workforce in like 10 to 15 years, what changes do you expect to see?
So the first thing that I would say is everybody who's listening to this should go into healthcare and medicine somehow, because there are so many different ways to have an impact in healthcare. You've heard me talk a little bit about working in the insurance field or the research field, but technology has a huge part to play in healthcare. So think of many patients who want to be seen while they're at home in their robes, and they're getting their care through telehealth. Well, to do that through telehealth video, kind of the way we're doing this on Zoom today, you've got to have a platform that is secure so that your healthcare information cannot be shared. You need a healthcare background to build in some of those safety requirements, and also to design maybe some AI chat features that allows you as a patient or a consumer to get a lot of information in, so that the time that you spend with your clinician is really quality time based on the input information in a way that's easy for you in a health literate manner. That ecosystem being built out is really important. It will allow us to scale the number of healthcare professionals in the country, but allow us to treat people and share information even globally. So that technology platform, care anywhere you are, is important. And it may also lower the cost of care. So if we've got data aggregated in a manner that allows us to know who you are, authenticate that we're talking to the right person based on their health information, you can not only ask questions about what someone may want to talk to you about today, but if you notice that they haven't had their colonoscopy or immunizations, you can do those preventive services at the same time. The second area that's changing a lot in healthcare is getting more care overall done in your home. So today, if you get really sick, you go to the emergency room or you go to the hospital. There's a new field that's called hospital at home that is growing pretty rapidly, where it doesn't matter how sick you are, depending on what services can be provided in the home, they are provided in the home. And that's really important because as you get older, when you spend time in hospitals and you have sunrise, sunset, the changes in just being in a new environment, it can really change how you cognitively recognize what's going on versus being at home with your family and having that comfort. And we see a lot of people as they get hospitalized and go home have this huge adjustment. If we can take that out, that would be really important. We're having a large aging demographic in this country, frankly, across the world. how we are providing care for aging family members is important. We look at caregivers as a key component. We're using nurse practitioners, community health workers, pharmacists a lot more. We think about team-based care. I think you're hearing me say there is absolutely nothing that isn't being rethought in healthcare and providing new opportunities. It's being invested in by Silicon Valley. It's changing payment models. It's changing the number of jobs that you have in healthcare. It's a pretty wonderful time to be in healthcare. There's no longer the traditional just a physician role or a nurse role. We've expanded a lot of that, and it's what we need to do.
Great. So I'm going to take a question from the audience. Did you always think that you were going to be interested in medicine, or were there other fields that you were considering?
That's great. So I knew, frankly, since I was 12 years old, that I was going to go into medicine. I had a grandparent who was ill when I was a child and had to care for him, my grandfather. And I liked the idea of being responsible for helping someone feel better and care for them, even though I was changing a wound and changing bandages. I was 12 years old, but I really liked being able to provide that type of empathetic care. And I think the second piece of it is I realized that he should get better care. And I think the commitment for me was I'm going to try to do that going forward. Didn't take away from some of my other interests. I actually really like to dance. Actually graduated from Brandeis early and spent some time dancing. My family will tell you they too have spent way too much time going to do dancing things. But I've continued to feel as if healthcare allows me to do everything. Dancing's great physical activity. I love to cook, and I'm from Trinidad, so I love kind of that Caribbean cooking, and I can do healthy cooking. So you hear, no matter how we slice this, I'm going to come back, and everyone on this call should go into healthcare.
Great. And then I'll take another question from the audience. So there's a question about, how did you manage your time while you were at Brandeis? Like, what sorts of things were you involved with, whether they were jobs or other, student organizations? Like, how did you, what kept you busy outside of class?
Yeah, so, I'll tell you the story. When I got to Brandeis, I'm from New York. In case you didn't recognize the accent, I'm actually from Brooklyn. I got to Brandeis, and I had gone to a New York City public school. I was raised by a wonderful single mom, and I'd gone from my public school, where I, by the way, had thought, gosh, you got into Brandeis, you're doing really well. And then I got to Brandeis. And, there are kids there who had taken AP classes. My high school never offered any AP classes. There were kids who were able to be exempted from many classes that I had to take. And so my first year at Brandeis was really an adjustment. It was a recognition that preparation for college really varied. And I'd come from Trinidad, as I mentioned. I'd been in the country about 3 years. And that was eye-opening to me, frankly, of the variations in preparations and, what if, right, a different primary education. But I'd done really well in my SATs, and I got to Brandeis. And I think what was really wonderful about Brandeis was they'd seen people like me before, really well in your SATs, but hadn't had a broad academic curriculum in your high school. And I remember, being told, it'll be okay. You can have any support. I got a tutor for calculus. I mentioned that I was raised by a single mom, so I actually had work study. Actually, my freshman and sophomore year, I worked at Sherman's cafeteria in the kosher kitchen. During my junior and senior year, I moved up from that job to the financial aid office, the kosher kitchen. However, I also got really good food anytime I wanted. So I remember that. So I had work study. I needed a tutor for calculus, and I was going pre-med. What really helped me during that time, my mom would ship these boxes of food, and so all of my friends would get to enjoy that. And then I had a lot of friends, in your freshman dorm, who would on Saturday nights, I won't tell you everything we did, but just know the same things you're doing, we did Saturday nights, and I was able to do that. And then Sunday, I'd go study. Sunday evening was always my big workout evening. So my weekends became, Cheryl, turn it off so you can do other things. Monday through Friday, I was totally leaned in. Probably did all of my classes, did my job, and I was at the library until 10 of 11. By my sophomore year into my junior year, that started getting better. So you're hearing someone say her first semester, she got lots of C's. By my sophomore, junior year, that looked really good. By my junior year, it was pretty great. And so that balance of getting a handle on my academics and making it a priority is what I did early on. And as I learned to do time management, got really more confident in my own capabilities and being able to survive in medical school and do well, that changed. I also worked as a volunteer in Waltham with seniors going into their homes, and that was actually a lot of fun and relaxing. Today, if I look back, if I had thought of this, those were the things, right, that were helping me with my own mental health, the ability to take breaks, the ability to care for others, the ability to laugh throughout, which today we tell everyone to do. Back then, just hearing how old I am, 1980, early 1980s, we didn't talk about it that way. But all of my advisors would say, what are you doing for yourself? And that really was very thematic. I mean, even Afro-American studies, right? I was learning something that I just didn't know enough about. And that felt, really wonderful as well.
Great. So I'll pose another question from the audience. So there seems to be a lot of interest sort of in your transition into more of like a healthcare leadership. So, how do you sort of, what steps do you take in your career? Like, what choices do you make in order to get into more of a health leadership role?
It does require additional expertise beyond medical school. So that I would say, you heard me mention, I went and got a master's in public health. I actually also spent some time which I did at Cambia in New York, and also took some classes in the legal department, because what we learn in medical school is the science of caring for patients and the different disciplines, be it cardiology, OBGYN, nephrology, about really mastering how you care for someone based on their medical condition. That's really important work, but there are many things you don't learn enough of in medical school, which I'm working now on a lot to change. You don't learn a lot about the business of medicine. So if you're seeing patients and you're prescribing medicines and your patients can't afford it, you should understand what's called a formulary. You should understand what's generic. You should understand patient programs that manufacturers may have. Those are skills that are absolutely necessary for people to take the best care of themselves, particularly people in underserved communities. So you've got to learn and understand some of that. The ways I did it is I realized after being in training, I think I was maybe a second-year resident, we were caring for patients. I had my own clinic, and patients would sign up for me to be their physician. And part of the reason wasn't because they thought I was a great clinician, it's because I looked like them. And they felt that there were things that they could ask me that they weren't asking. And so affordability of drugs, would it be possible for us to do a phone call for a visit because they had to take 4 hours off of work to come to the doctor. And so just frankly, interacting with patients, they were living the things I had lived in my own family. And if you ask the questions of how do you fix that, medical education by itself doesn't fix that. I want to fix those things. And so going into the different disciplines of healthcare allows me to focus on those, bringing my clinical expertise with me, bringing the importance of the patient comes first, or the way we say it in medicine, the patient is at the center of everything we do. That combination, I think, allows you to be able to not think of this just from how many patients are in the hospital and how many beds do we have. It begins to have you think of, what are we doing when people leave to make sure they have the right food so that they don't have to come back? What are we ensuring in their follow-up appointments? You get a 360 view. There's a phrase and a discipline called the quadruple aim. The quadruple aim looks at the care, the quality of care, the cost of care, and then the people providing the care. And so that discipline and that framework allows you to think about healthcare the way I definitely do. How do I touch each of those buttons? And all of the stakeholders, be they a payer, be they someone who's developing new therapies and innovating, and clinicians who include pharmacists, community health workers, researchers, they all have a seat at that table because we win when we work together in lowering cost and in innovating.
Great. I'm wondering what would be one of your proudest accomplishments as a cardiologist?
Wow. So let's think about that a little bit. I still feel there's so much to do, so I don't feel I've achieved my my proudest accomplishment yet. I would tell you that one of the things that I'm really happy about in 1992, 93, I became the second woman ever and the first African-American woman to become a cardiologist at Cornell medical training program. And that allowed us took another 5 years to really go after how do we diversify the workforce, because the experiences that I was just sharing with patients, we were seeing that occurring and we recognized we should do more along those lines. And so in 2000, I started a scholarship at Cornell for women and minority students. And every year since then, we've had a student go through, and just makes me really happy that, a lot of people who may not think about medicine because they think they can't afford it, they're bringing a lot of these naturally lived experiences, and we're really broadening out our medical discipline.
Great. So I'm wondering, because I think that, health equity training, at least in medical school, is sort of a hot button issue as of late. The AAMC published a report talking about the importance of it. And there was, a lot of pushback from different avenues about the place that health equity training should have in medical school. So if you were in a position to sort of create a curricula for medical schools, like what topics do you wish would be covered that maybe weren't covered in your own training?
Yeah, so you heard me talk about one of them before, the business of medicine. And you can leave medical school and not understand how to do the coding for billing that needs to happen as you go into practice. And so I think understanding what's required to be successful in the business of medicine, instead of us clinicians going, oh no, we'll get a business person to do that, we actually should understand it ourselves. And if you've gone through medical school, you can understand it yourself. So I think that's one area. What I will say is that part of what we've seen in healthcare is that healthcare differs by your zip code, right? In healthcare, we sometimes say your zip code is more important than your genetic code, because in different parts of the country, and in Boston, you can go one zip code over and the life expectancy decreases by 10 to 15 years. And so what we have to think about in healthcare is, how do we change that? Because you can do a lot of training on the front end and say to people, hey, when you are seeing a woman who may complain of back pain or left elbow pain, that could be a woman having a heart attack. It doesn't present the same way as it does in a man. Or hypertension starts 10 years earlier in someone who's African American. Or recently you saw the tools that we use to measure your oxygen levels don't work on different skin tones. That's a lot that you can put in on the front end. What you really want to do is help people at the time that they're taking care of a patient. And what we call that is actual point of care solutions, so that you embed different tools so that people, when they're seeing someone, they have the demographic information and clinical information. And AI is being utilized to say, hey, for this patient, think of these things. Hey, here's something you may want to look at. Not being judgmental about whether you treat different patients differently, but saying, it's a busy, long day. We're going to help you at the point of care. The second way that's really important is changing payment models in care. And so there's a payment model called value-based care. It's sometimes called accountable care. You mentioned, 10, 15 years from now, what are we going to see? We're going to see a lot of value-based care. And value-based care really says that when you're seeing someone, if they have diabetes, here are all the things you should do for that person. Because we've researched this, we have what's called evidence-based guidelines. You should treat them according to evidence-based guidelines. And if you do, we will pay you for doing that, and you will receive an incentive. When you shift payment models that says you have to go through actually doing all the things you have to do that's evidence-based, because that's the only way you will be compensated, you start seeing a shift of everyone treating everyone they see that way, because there is a carrot associated with that. And so I think payment models changing is really, really important for achieving health equity. And the last one, obviously, is in underserved communities or in rural communities. What we know is that people from those communities go back to those communities to care for them. So ensuring that we are having people enter the medical profession from different communities across the country really helps us in getting people to thrive and want to go back to communities that their families live in.
Okay, great. So we have a question. Were there any challenges that surprised you when you were co-founding a New Beat?
Yeah, so New Beat is an organization that's really focused on how do we get where most heart disease in the world occurs in women. Most early mortality occurs in minority populations, African Americans, Latinos. And so if you know that data, you should focus on that, right? To me, it just seems really easy. If we lift the boats in those areas, we can improve care across the country. Many people did not know the data. I mean, it continues to surprise me how many people don't know the data. So I think in starting that, being able to use my voice and my relationships to say, no, here's why this is really important, was a big learning. Setting up a not-for-profit 501(c)(3), just, the normal process in doing that. Once we started raising the voice of that, think about when I started a New Beat to today, when you hear everyone talk about health equity, now people reach out to us. In the early days, we were doing introductions, and I think introducing it in a manner of want to share what the data says, want to share what we're doing, not, oh my gosh, people, can we jump on this right away? So really lots of learnings there. And how do you communicate for engagement and partnerships versus, come on, chop, chop. This is something we should have been doing. And so now it's relatively easy. To your point, it's become the standard. Back then it was not.
Great. So I'm wondering if there are other things that you want to share about your new role at Morgan, or what your goals are there.
Yeah, I've done different things in my career, have spent a lot of time learning in different areas, but building out infrastructure. You can't care for a population unless you know that population. And with my work at Aetna, we were the first to collect race and ethnicity data across a 30 million membership. Really allows you to then say, okay, how do we tailor what we're doing? We now know gender, race, ethnicity. We can do different solutions. Did some of the early payment reform programs that I'm talking about now for value-based care. Back then, we called it pay for performance, really trying to shift towards that area. And recently at Walmart, looking at rural and underserved communities and giving that access, even if it's through a retail channel, to be the front door to healthcare. So those are all, for me, really important building blocks that are scaled, sustainable, but we still have a lot to do. And we still have a lot that we want to innovate. And working with this incredible team at Morgan Health, it's really to help innovate and innovate in a holistic manner where you can bring your expertise as a clinician, your expertise in having worked as a payer, worked in retail health, worked in different healthcare settings, to be able to bring that together to ensure that the things that we invest in fill gaps that we have in healthcare, and allow us to improve health equity, look at value-based care payment models, focus on some of our chronic conditions, and move us earlier into care and prevention, because we understand what we should be doing, because we've changed medical education to focus on nutrition, early activities that help people do what they're doing. So it's kind of coming full circle. It's like, once you learn a lot, it's like, okay, can we do this from the starting point? And I think my work at Morgan Health is really to focus on that.
Great. What do you think are some of the biggest challenges for physicians today? And what advice would you give to those who are sort of going into that field?
So the first I've already mentioned, go into the field. It is an incredible field. I have 2 children. I was able to take time off. I'm a cardiologist, go back to practice, go into the field. It's a wonderful community. And every day you get up, you feel like you're doing something great. What I will say is we're a lot more knowledgeable now about taking care of yourself, what I called a quadruple aim. By the way, when I was in training, it was called a triple aim. We added quadruple onto it to remind us to take care of yourself, your own mental health, taking vacations, ensuring that you're getting enough physical activity. And so what I would say to people is a little bit of what you learn when you're in college, which is, how do you do time management for yourself of how much time am I studying? How much time am I spending on my family? How much time I'm spending on myself? Don't think that those skill sets aren't translatable. They are probably some of the most important skill sets. If you can have an after school activity, you may have a job the way I did for work study, and you're having fun with your friends and maintaining your grades, you've got a lot of that down. Take it with you. And the only other thing I would say is care for each other. I think, we sometimes don't ask someone we see who's struggling, how can I help? In healthcare, in medicine, medical school, it's the first time you'll be dealing with a cadaver. I mean, there are a lot of new things that you have. It is okay to raise your hand and ask for help. There is no, frankly, I get nervous when people say, no, I've got this, I don't need any help. I think in medical school in particular, We're trying to teach you everything we've learned in science from day one until you joined. And we say that science has rapidly expanded even in the last 4 years. So just imagine what that feels like. Ask people, how are they doing it? How are they succeeding? Healthcare is a team-based sport. Having a team around you to help you succeed in medical school is really, really critical. But I think you learn it at Brandeis as well.
Great. And what piece of advice would you give to your former self at Brandeis if you were going to give yourself your former self advice?
That's really funny. I would say that, you may think that you have no idea if you're cut out for this, or if you will even do it. You'll be thrilled just to take the MCATs, much less do well on it. But what you should remember is that the relationships that you formed, the people who, I didn't have a driver's license in college, the people who drove you to the Kaplan courses, those relationships that you formed, those will be the ones that will be there for you for absolutely ever. And investing the time, whether it was microwaving things in cups that became your meal late at night at midnight, you remember those with joy. I will tell you that my mentors today, even in medicine, will always say to me, remember that the time that you spend with your family and with your friends, that's where you're really growing, because you let your guard down so that you can take in feedback and information. And so that for me, I'd say I probably could have spent more time on it, but man, was it great. And a lot of my friends today are people I went to school with, and they're not in medicine. They're doing different things, but they were there. They watched me go from the Brooklyn person to going to Cornell Medical School. So they know all the stories.
That's amazing. So I'm wondering too, like you sort of mentioned like some of the sort of mental challenges of this path. Have you ever experienced like imposter syndrome, like wondering if this was a place you were supposed to be? Because that's when I talk with students, I think a lot of our students at Brandeis are sort of struggling with that at different levels.
Yeah. By the way, am I not doing that now? So, what I will tell you is there's a bit of getting safe and comfortable with what you do. So you almost conquer imposter syndrome. And that for me could have been trained to be a doctor, became a cardiologist, stay practicing doing that. And that way you build expertise. When I went to Pfizer, I will tell you, I felt like I was the stupidest person in healthcare, because everyone, even a marketing MBA, understood more about medicine than I did. They understood that it doesn't matter what the doctor told you and wrote in a prescription if you can't afford it. It's so simple. Just not something that I thought about. And that actually, my time at Pfizer, probably my most humbling and my most growth in recognizing that physicians didn't know everything in healthcare, and we actually needed to partner with different disciplines for us to change and make this healthcare system better. And I learned a ton. It was also a place where a company invested in me. I had a coach, and I got to share kind of the dream fantasy of, I'm going to change healthcare. Please help me and tell me how to do that. And I would say my other big jumps, I jumped into health insurance. I mean, I knew nothing, for those of you who know Drake started at the bottom, now we're here. That's happened to me in many phases of my career. Retail health. I was the first chief medical officer at Walgreens. Had to kind of develop, what does that mean and what does it look like? And so, yes, imposter syndrome, or yes, risk. Yes, you have to learn a lot, but I'm pretty comfortable saying to people, I have no idea what you just said. Please repeat that. I try to do that really early in any role that I have, because 2 years into it, people are going to go, really? You don't know that? But for your first 2 years, I'd say go for asking every stupid question that you have. That, by the way, if there's one secret to success that I share with you, it's that.
Okay, great. Is there anything else that you would like to share that we haven't already covered?
I owe my career to Brandeis. You've heard me talk about coming from high school and needing to be prepared to go to medical school, but you've also heard me talk about needing help to succeed throughout. I would just say to everyone, asking for help is a sign of strength, is a sign of leadership. Trying to do it on your own and failing and using a lot of time is not helpful to you. Once you get really comfortable in asking others about things that you need and trying to find those partners, those paths, I think that's where you really grow. And yes, you may feel like an imposter, but you're an imposter in training, and in training to become someone who knows what paths to take. So I would just recommend that people think about that, to not try to struggle through things your own. There's way too much that others have done before you that you should be able to quickly learn.
Okay, great. And I'm wondering, so maybe one last question here. So it seems like, throughout your career, you've found ways to combine your interest in medicine with other interests you have, like you're a published cookbook author. You mentioned your interest in dance, which is really amazing. I know many pre-health students that are involved with dance at Brandeis, so I'm sure that there will be folks that are happy to hear that. Why do you think that's important, right? Like, I think so many pre-health students sort of imagine that there's some sort of checklist of things that they have to do in order to be prepared for medical school. But it's clear that you've also left space for some of your own interests. So why has that been something that you've sort of continued to pursue?
So I think is there a traditional way to be a good doctor or to be a good human giving back to society? The answer is no. The answer is, can we figure out what works for us to give back to others, but don't forget how you give back to yourself. Sometimes we prioritize everything, and my husband would say, it's the kids, maybe hanging out with people, work, and he sometimes fits into there somehow because he's not asking for a lot. I think for all of us, it's that prioritization that we have to think about. For you to be able to have really good output, and now I'm going to go purely neurological, what the science tells us is the plasticity of neurons requires us to be able to see and do something different for us to be able to achieve even higher in a particular area that we're really deeply leaned in on. And so there is science behind wanting to make sure that you broaden those interests. But frankly, the other part of it is you don't care for patients or work in a hospital or work in a research lab all the time. You do other things. You have to eat. You've got to get physical activity. You've got to get fresh air. You have to form relationships. Those are, we downplayed sometimes, right? Particularly when I was in training and we would do, 36 hours on call, we downplay how important those aspects are. We now know today that being able to get enough sleep, to be able to do something besides the work that may be stressful, spending time with others, not only impact the development of neurological diseases as you age, but obviously impacts your cardiovascular health, and most importantly, your mental health. And so these are things I enjoy. It is okay if I am late for something or I'm handing something in late. I'm okay managing that. But if I don't spend the summers with my family trying to figure out our next cookbook, they will talk about me forever. And, we have a saying, I think it may even be in my Brandeis yearbook, but, I can be replaced in all aspects of my life, except as a mother and a daughter. And, it really just kind of grounds me into reminding myself about the important things that I should be doing. So I balance and manage that time. Most important thing that I've learned is being able to say no. I do not have to be at every event. I do not have to sign up to be at a potluck or something. It is okay to say no and take some time for myself. So I'm probably still learning how well to do that, but I've gotten a lot better than I used to be. And so I think that's really, really important.
I always tell my students every yes is also it needs to be a no to something else. Otherwise, you just get overloaded.
You can't do it.
Well, thank you so much for this conversation. It was really wonderful to hear about, your experiences at Brandeis and all the wisdom that you had to share sort of about the healthcare industry. So I'll turn it over to Melissa.
All right, great. So this was really, really amazing. So thank you so much. Really appreciate all your knowledge, sharing so many great insights, words of wisdom. And I know everyone probably feels the same. And we'd love to host you sometime on campus in person when the weather is warmer, of course, right? No snow, right? So on behalf of all the viewers that joined us, thank you for watching. I'd also like to give a special shout out to the sponsors of today's talk, which includes Pre-Health Advising, Academic Services, and the Hyatt Career Center. So again, thank you, everyone, and we're going to close. All right, have a good
Thank
rest
you.
of the day. All right, bye.